So this video is going to look at the 4 Ds of diagnosis. Now, just to start, psychopathology is where we look at the symptoms and features of mental disorders and explanations that can offer the causes for the disorder, and then those causes obviously lead to us allowing us to create treatments for that disorder. So we also look at how abnormal behaviour is designed and actually what classifies something as a mental disorder. So, before diagnosing an individual with a clinical disorder, it first needs to be identified that they're suffering from a clinical disorder. So, judgments about abnormality are not based on one set criteria. Instead, judgments are influenced by the interaction of considerations. So, the main method of identification that's actually used by clinical psychologists is the 4 Ds of diagnosis. So, the 4 Ds of diagnosis are deviance, distress, dysfunction, and danger. You have to know all 4. So deviance. This is behaviours and emotions that are not seen as the norm in society and are therefore deemed as unacceptable. So we're going to look at 2 ways in which people can deviate away from this. So we're looking at behaviour that is statistically infrequent or behaviour which deviates from social norms and expectations. If we start with the first one, deviation from the statistical norm. We quite often measure how abnormal somebody is by how often the behaviour occurs, and therefore anything that occurs very rarely in relation to the population is termed as atypical or abnormal. From a statistical point of view, abnormality is any substantial deviation from the statistically calculated average. So in any measurable human characteristic, most people's scores will cluster around the average, and as we move away from the average, fewer and fewer people will attain that score, and this is what we call a normal distribution. If you look at this mathematically, this is a normal distribution curve, or often known as a bell curve. Up here is where most people's scores will fall, and we call this the golden mean. Anybody whose scores fall down here, that means that they've got a statistically lower score, and anybody's scores that fall down here are going to be statistically higher. Those who fall within this golden mean here, those who do what most other people do, they're seen as normal, while those whose behaviour differs from the majority are abnormal, so those people here and those people down here. This way of defining abnormal behaviour really works with things like depression, anxiety or intelligence, because we know that these areas are measurables by most people's scores. So for example, the average IQ score is about 114. Now if anybody gets higher than that, so for example 156, much fewer people will have obtained this score, so we would call it an abnormally high score. The further away from the mean you are, the fewer and fewer people have this score, so the behaviour is viewed as abnormal. Behaviour that falls outside 2 standard deviations from the mean, so about 4%, and below of the population will be considered abnormal. The second explanation here is deviation from the social norms. So norms are expected ways of behaving in society according to the majority, and those members of society who don't think and behave like everybody else break these social norms, so are defined as abnormal. When somebody defies social norms, it attracts our attention and provides us with the sort of information we can use to make judgments. We all tend to notice and be wary of people whose behaviour does not conform to social norms. This abnormal behaviour is seen as vivid and unpredictable, which causes the observer discomfort and violates moral or ideal standards because this differs from what most people do. So for example, people who are diagnosed with antisocial personality disorder are often known as psychopaths. And one of the defining symptoms of ASPD is a failure to conform to social norms with respect to lawful behaviours, as indicated by repeatedly performing acts that are grounds for arrest, and that was quoted from the DSM. However, judging someone to be abnormal simply based on behaviour that defies social norms can be really dangerous, and there are aspects that need to be taken into account, such as liberty and social control. There are loads of examples from history where it's clear that for one reason, defining certain behaviours as abnormal was a way of maintaining social order over certain groups, such as women or ethnic groups, such as slaves who expressed a desire to leave were diagnosed as mental health disorders, women who were unmarried and had children, men who were gay. All of those seem ridiculous to us now, but it's only because the social norms of society have changed so much. As recently as 1970, gay men were given psychiatric diagnosis and were treated with painful electric shocks. Another thing to consider here is the effect of culture. So social norms are culturally specific. So for example, hearing voices in one culture might be considered totally normal and actually interpreted as being connected to the spirits, whereas in Western cultures it's seen as abnormal. So it's really impossible to define these norms that have to be adhered to in all societies. Cultural differences can cause immense problems with mental health because from one culture to another they can be assessed as different things. It's really important as well to view the effect of context and situation, because the situation and the context of the behaviour are really important. Behaviour might be normal in one context but totally abnormal in a different one. And finally, the effect of age and gender. Age is a massive factor in making a judgment about abnormality. So, for example, a 3-year-old might take their clothes off in public, and this is seen as totally normal and therefore within social norms. However, if a 40-year-old with no specific context did the same thing, they would be seen as not acting within society's norms. Similarly, what is seen as normal for a female may be seen as abnormal for a male, and vice versa. So, distress. This is the subjective experiences of an individual when the behaviour is causing the individual to have high levels of negative feelings. Obviously, everyone experiences negative feelings from time to time, such as exam stress, bereavement, relationship breakups, victims of crime or disasters. However, abnormality is when these negative feelings incur inappropriately or persist longer than they should. This has the advantage of connecting abnormality to quality of life, so the same as dysfunction, which we'll look at in a second. You may have odd behaviours like keeping 100 cats in your house, but if it makes you happy, then who cares? On the other hand, a phobia of cats is a trivial thing, unless it prevents you from going outside for fear that you'll meet one, in which case it's clearly distressing for you and it needs to be treated. The problem with this is that judging distress is really subjective. It's perfectly normal to be distressed in certain situations. So after all, who's to say how long it should take you to grieve for the death of a loved one or the breakup of a relationship? Some people get very distressed about global warming or animal welfare. Well, is that abnormal? Then there are people who don't really feel distress at all, when other people think that they should. So if a person stops washing or wearing clean clothes or going outside, most of us would regard that as abnormal and cause for concern. But if they're perfectly happy being a slobbish couch potato, then shouldn't they just be left to get on with it? When Prince Albert died in 1861, Queen Victoria went into mourning for the remaining 40 years of her life. She wore black every day, and she stayed at home for 13 years, refusing to even open Parliament. Is that abnormal? Dysfunction. This is when abnormal behaviour is significantly interfering with everyday tasks and living your life. Under this definition, a person is considered abnormal if they are unable to cope with the demands of everyday life, such as looking after yourself, holding down a job, maintaining relationships with friends and family, or making yourself understood, etc. There's an example on the board of some research which suggests that the characteristics that define your failure to function adequately are things such as unpredictability and loss of control, irrationality, you cause discomfort to other people, vividness and unconventionality, or violating moral standards. Dysfunction gets across the idea of behaviour getting in the way of living a healthy life, which the statistical definition of deviance ignores. But it's a little bit more objective than appealing to social norms. For example, even if a person's sexuality is unusual or shocking to other people, if they can still live a healthy life, then it isn't seen as abnormal. A problem with this abnormal behaviour is that it may actually be helpful for the individual. So, for example, taking drugs might help a person with a stressful situation or a job, or help an artist unlock their creativity. In fact, there may be some social groups where not taking drugs is dysfunctional behaviour. I say might. They might also kill you. Look at Kurt Cobain. Don't take drugs. Also, people may engage in behaviour that is unhealthy, but we don't class that as abnormal, such as adrenaline sports, smoking, drinking alcohol, or driving too fast. Danger. This is when the behaviour harms or puts at risk the individual or others around them. It's based around the harm principle, which states that you have a right to behave in any way you want to as long as you don't cause harm. Obviously, there are some things everybody does that can be harmful, like driving a car, but abnormality behaviour puts yourself and other people at excessive risk, so driving a car while drunk. This is similar to the principle of distress because it takes quite a liberal view that people should be left to their own devices if their behaviour is harmless, as opposed to the deviance and dysfunction principles. The 4Ds are useful in summarising mental health disorders. There is no clear scale between normal and abnormal, and this means that identifying a clinical disorder using the 4Ds is based on the practitioner's judgment. It's important that when you're using the 4Ds, you take in the context of a person's situation. The 4Ds may be present in an individual, but a little bit further explanation or a diagnosis will not be made. The evaluation of using the 4Ds to identify a clinical disorder. One of the difficulties of diagnosing mental health illnesses is deciding when a characteristic or a trait becomes problematic, and problematic enough to become a clinical diagnosis. The 4Ds can assist in making a decision by matching the 4Ds to the DSM-4 revised. Therefore, the 4Ds have a practical application, as they're used by practitioners and they can help people and help them see when a condition might need a DSM diagnosis. Various diagnoses using the DSM are shown to focus on specific Ds, showing each has a value. So, for example, in the DSM, paedophilia is clearly indicated by deviance, and distress must also be present as well as dysfunction. Furthermore, Munchausen is a disorder where the individual will fake illness or psychological trauma to get medical attention. This clearly indicates deviance from the norm, as well as distress felt by the individual through faking the illness. Danger can be present as well, as they may harm themselves to validate their claims, and dysfunction may occur as the individual will be focusing on creating an illness that may not sufficiently partake in the life. Therefore, this supports the validity of the DSM as a diagnostic classification system, and it also clearly measures a diagnostic disorder. The 4Ds can be applied really subjectively. As there is no clear measure of the 4Ds, this requires the practitioner to use their professional judgment, and what one professional views as dysfunctional such as not going to work, may not be considered dysfunctional by the individual themselves or by another professional. Therefore, this reduces the validity of using the 4Ds, as there is no clear measure or agreement to use them. Furthermore, the lack of objectivity of the 4Ds raises issues about their reliability. If the 4Ds are used by two different professionals, they may not react in the same way and reach the same conclusions about the mental disorders, and thus the reliability of the measure is reduced. Davis, in 2009, discusses the need for a fifth D, and he says duration needs to be considered. Now, duration refers to the length of time that an individual has had symptoms. So, for example, different types of schizophrenia may be diagnosed depending on how long the patient has experienced symptoms. Schizophrenia undifferentiated requires symptoms to have lasted for more than a few hours, whereas schizophrenia disorder is of a possible diagnosis if symptoms have lasted more than 1 month, but not longer than 6 months. Therefore, the 4Ds are insufficient in themselves to make a diagnosis. We also must consider social control. Labelling an individual as abnormal using the 4Ds will lead to a diagnosis of a clinical disorder, and this forces the individual to conform to the standards set by society. If they don't, they receive treatment that will normalise their behaviour. This, therefore, does not allow for the individual to behave as they would want to, because it exerts control over their behaviour. There are also practical issues with the 4Ds. The diagnosis process is often conducted through clinical interviews with patients by clinicians. These are often unstructured or semi-structured interviews, so detailed information can be gathered on the problems to make a well-informed judgment. And this can also lead to problems such as social desirability bias.